So students, after studying toxoplasma and plasmodium, which are the blood and tissue sporozoa, we shall study in brief another blood and tissue sporozoa which is rarely seen and which is not so important, that is Babesia. Babesia ಏನಪ್ಪ, it has got two species, ಎರಡು ಸ್ಪೀಶೀಸ್ ಇದೆ. ಯಾವ್ಯಾವುದು? Babesia microti ಮತ್ತು Babesia divergens. Okay, and this Babesia like toxoplasma ತರ ಟ್ಯಾಕಿಸಾಯ್ಡ್, ಬ್ರಾಡಿಸಾಯ್ಡ್, ಸ್ಪೋರೋಸಾಯ್ಡ್ ಈ ತರ ಎಕ್ಸಿಸ್ಟ್ ಆಗಲ್ಲ. ಪ್ಲಾಸ್ಮೋಡಿಯಂ ತರ ಮೀರೋಸಾಯ್ಡ್, ಸ್ಕಿಜಾನ್, ಗ್ಯಾಮಿಟೋಸೈಡ್ ಈ ತರ ಎಕ್ಸಿಸ್ಟ್ ಆಗಲ್ಲ. ಇಟ್ ಎಕ್ಸಿಸ್ಟ್ ಇನ್ ಓನ್ಲಿ ಒನ್ ಫಾರ್ಮ್, ದಟ್ ಇಸ್ Babesia ಅಂತ ಒಂದೇ ಒಂದು ಫಾರ್ಮಲ್ಲಿ ಇರುತ್ತೆ. And it is transmitted by a vector known as ixodid tick. Ixodid tick ಇದು ಬೇರೆ ಬ್ಯಾಕ್ಟೀರಿಯಲ್ ಡಿಸೀಸಸ್ ಅನ್ನು ಟ್ರಾನ್ಸ್ಮಿಟ್ ಮಾಡುತ್ತೆ. ixodid tick, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಲೈಮ್ ಡಿಸೀಸ್ ಕಾಸ್ಡ್ ಬೈ ಬೊರೇಲಿಯಾ ಬರ್ಗ್ಡಾರ್ಫೆರಿ, ಆ ಡಿಸೀಸ್ನು ಇದೇ ixodid tick ಟ್ರಾನ್ಸ್ಮಿಟ್ ಮಾಡುತ್ತೆ. ಅದೇ ಥರ ಬೆಬೇಸಿಯಾನು ಇದೇ ixodid tick ಟ್ರಾನ್ಸ್ಮಿಟ್ ಮಾಡುತ್ತೆ. ಓಕೆ, ಹೌ ಡು ವಿ ಡಯಾಗ್ನೋಸ್ ದಿಸ್? ಪೆರಿಫೆರಲ್ ಬ್ಲಡ್ ಅಲ್ಲಿ ಜೀಮ್ಸಾ ಸ್ಟೇನ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಜೀಮ್ಸಾ ಸ್ಟೇನ್ ಯೂಸ್ ಮಾಡಿ ಪೆರಿಫೆರಲ್ ಬ್ಲಡ್ ಅಲ್ಲಿ ನೋಡಿದಾಗ ವಿ ಗೆಟ್ ಟು ಸಿ ಸಮಥಿಂಗ್ ನೋನ್ ಆಸ್ ಮಲ್ಟೀಸ್ ಕ್ರಾಸ್ ಸೈನ್. RBC ಒಳಗಡೆ ಈ ತರ ಅಪಿಯರೆನ್ಸ್, ದಿಸ್ ಇಸ್ ನೋನ್ ಆಸ್ ಮಲ್ಟೀಸ್ ಕ್ರಾಸ್ ಸೈನ್. ಓಕೆ, ಮಲ್ಟೀಸ್ ಕ್ರಾಸ್ ತರ ಕಂಡು ಬರುವಂಥದ್ದು RBC ಒಳಗಡೆ ವೆನ್ ವಿ ಡು Giemsa staining of peripheral blood smear. The drug of choice, the treatment for this is atovaquone. Atovaquone is the drug that is used to treat Babesia. Okay, this much if you know about Babesia, that is more than enough. Okay, let us see how do they look like. See, Maltese cross, this is an RBC. Here you get to see this Babesia organism inside the RBC, that appears like Maltese cross. Okay, even here you can see Maltese cross. This is the image of ixodid tick that transmits Babesia and Lyme disease, a bacterial disease which is caused by the bacteria Borrelia burgdorferi. Okay, and the treatment of babesiosis, the disease caused by Babesia, is atovaquone. Okay, atovaquone is the treatment or drug of choice for Babesia. Okay, so by this we complete the first part of parasitology, that is protozoology. We started with definition of parasites, types of parasite, that is endoparasite, ectoparasite, and then we studied classification of parasite. We saw a parasite which is largest and which stays in large intestine and which does not cause any disease, that was Balantidium coli. And then we studied amoeba. Amoeba alli navu ಏನೇನು ನೋಡಿದ್ವಿ? We studied intestinal amoeba, that is Entamoeba histolytica. And then we studied free living amoeba, that is Naegleria, Acanthamoeba and Balmuthia. And then we studied intestinal flagellates. Intestinal flagellates ಯಾವುದು? Giardia lamblia ನೋಡಿದ್ವಿ. And then we studied sexually transmitted flagellate, that is Trichomonas vaginalis. Okay, and then we saw blood and tissue flagellates. ಯಾವ್ಯಾವಪ್ಪ blood and tissue flagellates? We studied blood and tissue flagellates ಯಾವ್ಯಾವು? We studied trypanosoma and leishmania. Okay, then we studied sporozoa. Sporozoa ali there are certain intestinal sporozoa, there are certain blood and tissue sporozoa. Blood and tissue sporozoa ಬಂದ್ಬಿಟ್ಟು we studied toxoplasma, plasmodium and now Babesia. ಈಗ Babesia ಓದಿದ್ವಿ. And then there are other intestinal sporozoa. ಅದನ್ನು ನಾನು ಫಸ್ಟ್ ಕ್ಲಾಸಲ್ಲೇ ಹೇಳಿದ್ದೆ ಕ್ಲಾಸಿಫಿಕೇಶನ್ ಹೇಳುವಾಗ. Cyclospora, Cryptospora, Isospora. These are the three intestinal sporozoa. Okay, they are acid fast. ZN staining ಹೇಳೋ ಕ್ಲಾಸಲ್ಲೂ ನಾನು ಹೇಳಿದ್ದೀನಿ. ಆಸಿಡ್ ಫಾಸ್ಟ್ ಪ್ಯಾರಾಸೈಟ್ಸ್ ಯಾವ್ಯಾವು? Cryptospora, Cyclospora and Isospora. These sporozoa, they cause intestinal infection, diarrhea in immunocompromised patients. HIV patients are usually ಡೈರಿಯಾ ಕಾಸ್ ಮಾಡುವಂಥ ಪ್ಯಾರಾಸೈಟ್ಸ್ ಇವು. ಟ್ರೀಟ್ಮೆಂಟ್ ಫಾರ್ ದ್ಯಾಟ್ ಈಸ್ cotrimoxazole, trimethoprim and sulfamethoxazole, that is cotrimoxazole is the drug of choice for intestinal sporozoa. Okay, so with this we conclude the first part of parasitology, that is protozoology. Okay, in the next class I will start with helminthology, helminths, ಜಂತು ಹುಳುಗಳ ಬಗ್ಗೆ ನೆಕ್ಸ್ಟ್ ಕ್ಲಾಸಿಂದ ಕಲಿಯೋಣ. ಓಕೆ, ಸೊ I hope you are able to understand all these topics clearly. So if you have any queries, feel free to contact me. Okay, so thank you for your patient listening. Thank you all.